and the whole church erupted in clapping. And I was thinking, what are you clapping? Because I'm hearing that you're clapping that she's not had any withdrawal side effects from stopping her life-preserving medication. I'm not hearing that she's been healed.
Well, hello and welcome to the Restore Healthcare Project. I'm Dr. Jennifer Kang. Happy to have you along with me. Want to remind you to like, follow, subscribe. Thanks for your feedback. I think we're going to have a very interesting and challenging episode today, so I'd love to hear your feedback and comments, your reactions. I am here today with Dr. Mike von Fraunhofer, who some of us may know from prior interactions and with Restore Healthcare Project in general. And we are looking forward to sharing a little bit of our expertise together, as well as our humble opinions. Dr. Mike von is a very experienced, shall we say how many years, Mike? General practitioner. 35 years of practicing in the NHS, leading as managing partner in several practices. Also very involved in Heaven and Healthcare, a sister movement in Europe and coming out of the UK, leading in churches and in healing centers, married to his beautiful wife, Sarah, with 2 children. Just an incredible diversity of experience that you bring to us, Mike. Thank you so much for joining me.
That's my pleasure. Thank you for asking me.
And we have been stirred in our hearts, as I'm sure many others have been at this season, of where we're at in the world and where we're at in ministry, where we're at in healthcare, and the divergence and the convergence of some of these things. One of them being there's a bit of an upheaval in the Christian movement right now in terms of exposure and disclosure of multiple healing ministers, prophetic ministers who've turned out to have very discordant lives with the gospel, who've turned out to have fake healing or prophetic ministries, who've turned out to have predatory behaviors, some of which are quite shocking and feel like a little bit of a rerun. We've experienced this in the Christian movement over the last couple of years especially, but decade. And it's heartbreaking and it's difficult to process. And one of the things that Dr. Mike and I wanted to process a bit today were some areas that we see in Christian healing ministry from a Christian healthcare professional's perspective that need speaking to. There's no other way to say that, Mike. What is some of the things that you would how we could approach this together?
I think the important thing is that we start with the fact that there are godly people who are setting out to try and glorify Him and provide practical provision in terms of healing and comfort and support. And we want to honor that effort, that work. And also, I think it's important that, because we were talking about this, that we say that we believe absolutely that God heals, that He performs miracles today, that He's used both you and I to perform miracles. We've seen Him use other people for miracles. It is an active part of what He's doing in the kingdom today. And so what we talk about today is not to try and downgrade what God is doing, but what we want to do is get to the purity of what God is up to and remove some of the stuff which is sometimes done with the best of intentions or sometimes done with wrong intentions, but they don't glorify God. And the world can see through it.
Yeah. I mean, we are kind of positioned in a unique position in that we have credentials and licensing to practice professional medicine, and we've done so for many years. And we also simultaneously have been drawn into the heart of God in divine healing. And I guess in some respects, we here at Restore and in other places, Heaven and Healthcare, as well as in pockets, I would say, of the Christian church currently, believe that God heals both through divine intervention as well as modern medicine.
Absolutely.
And
Absolutely.
it's crazy to have to say that that's radical, but in some ways in our movement, it is a little bit, and it has been throughout the last century. but it's also imperative that we continue to say that. Yeah, we actually do believe, and we've seen and participated in miraculous healing encounters, simultaneously holding in this other hand modern medicine, believing that God gifted that too.
Absolutely. Yeah, I think that's so right. I think it's important to flag out that Paul Manwaring in his surgery is not a second class healing was almost like a sentinel moment where he stood up and said, it is not a discounted healing if you have it through medicine. Um, and the pastor that I launched our own healing center with, Pete Carter, who is a GP, but then went on to be full time in the ministry. He used to have a wonderful way of putting this, which is if you have a headache and you take an aspirin, but you also get someone to pray for you, if the headache goes and you try and work out which was the thing that made it go, you haven't understood the point, which is that you had pain, it's now gone. And both methods were God's way of resolving it. And I think that's what we've done is we've split it, we've divided it. And if you look down through, I think you've done some sort of background reading on this that it's almost become a case where Christians are not allowed to access medicine. It's seen as false.
Yeah. And that itself is troublesome and potentially harmful. And so we're going to talk a little bit about some of these areas that we, from our professional medical opinion and viewpoint from our side of the room, there's some things that are potentially worrisome, are potentially harmful, many of which are just based out of probably innocent ignorance. As well as there's some historical reasons for some of these weeds in our garden. And I do want to say, as we embark on this adventure together, that it may sound a little bit to our audience like a line item indictment of bullet points of things that we are like this, and this. And actually, both of us have had our feet deep in the fields of healing ministry and greatly value and treasure the poured out work and lives of both healing ministers who are known, as well as the countless numbers of ordinary, common Christians who believe in healing and pray for healing, who give their time to function as prayer servants, whether in events and services or just regular everyday church life, as well as this concept that's developed over the last century of healing centers, healing rooms. So many people have given of themselves, and you and I have actually participated directly and personally in those endeavors. I wonder if you might speak a little bit to your background
Sure.
and your thoughts about healing centers, Mike, because it's dear to your heart.
Well, it is. It actually all started in about 2010 when I went to a Bill Johnson conference in the part of Kent, and just by happenstance, I happened to sit down at a table and discovered I was sitting with two other Christian GPs. And then Dr. Pete Carter, who was hosting the conference, came and sat down because he knew those two GPs. And we suddenly realized that at that table were four Christian GPs, all of whom believed that God healed, which is almost a unique occasion. I don't know how you found it, but those listening to the podcast, you'll know that most Christians may not actively believe that God heals. And so to have a gathering of four who all believed that it was possible for God to heal and be fully qualified medics at the same time seemed very rare. So we just basically sat around and chatted for a while. We're supposed to go and do some kind of evangelism thing, and we bunked that, and we just stayed talking and talking as medics can only do when they get in a room. But out of that came a breakfast meeting. Where Pete, who led a church, was now called Eastgate, was called North Kent Community Church. He invited medics and also people on the ministry team for his church for a breakfast meeting to talk about, could we set up effectively something like Bethel, a healing center? But what we wanted to do was have a center that was medically credible. I was involved in the commissioning of healthcare in the North Kent area. And I wanted to put a center together that I could go to my colleagues on the board commissioning healthcare and say, why don't you commission this? Why don't you refer your patients to this? So from the very outset, we wanted a centre that I, as a GP, could advertise to other GPs in the locality. This is a credible place to refer your patients to. Um, and I call it the bacon meeting because all the ministry team people were partaking of the fruit and the toast, and all the medics were partaking of the bacon butties that were fully available. So there was a cultural divide on the culinary scale. So exactly, the doctors were going for the bacon. Um, but out of that, I was commissioned to write the governance for this health center, healing center. And so basically, everything that we did was with a view to it needs to be credible. So we had to only do things that you would find acceptable if a GP referred a patient. So we had a very clear welcome sort of brief that the people had to read. They had to sign a disclaimer that said that that they would only do what they would only move things that were medically allowed to move. They'd only take off appliances that were medically allowed to take off. That they would only end medication in conjunction and liaison with their team. That we would not offer medical advice or guidance. We also had a clear accountability. So everyone that signed in were given a number, and we could track them. We knew exactly who'd prayed for them. So if there was ever a complaint, we could then track back. We had safeguarding training. Everyone on the team was given safeguarding training so that we made sure that it was appropriate. So everything was done in a way that I could stand up and did. In fact, 6 months or so later, or maybe a year later, I stood up in front of 200 GPs in North Kent and advertised the healing centre and basically showed the rationale for what we did. I showed some of the data we had in terms of people reporting pain reduction post intervention. And said, you can refer to us. We are safe. So that was our starting point, and that was our main goal, and I think we achieved it.
Wow. And I think what you've just laid out is actually quite innovative and stands out a bit in contrast to some of the models that have existed for a long time. And I think it is because foundationally, the two of you, Dr. Pete Carter and yourself, brought together your professional perspective to the ministry. And so there were pieces that were different in the way that it was structured that I think brought safeguards. And we'd like to kind of get into that a little bit because I think the model that you've lived out was really remarkable, honestly, and actually quite different from some of the things that we have seen in the charismatic Pentecostal movement of healing, as well as what we are seeing now that we would like to begin to speak out about. And spoiler alert, we are going to talk about leg length scams. We're going to do it. I know that for many health clinicians and medics, they're probably feeling a bit of relief, like finally somebody's actually talking about this. This has been bothering me and triggering me for years and years. And I also have been drawn into this beautiful experience of the presence of God to heal. But I'm also really bothered as a medic when I see these things happening in healing ministries. And I'd like somebody to talk about it. So I think there's going to be some degree of relief when we say, hey, we all know that's not right. So without further ado, I want to bring a little bit of history, if you'll indulge me for a minute on my little history journey, because I want to review a little bit of how we got here and the models that have been present and teaching Christians how to do healing ministry that we would like to just begin to parse out, hey, there's some weeds here. And why did they get there? Because I think that the heart of God is actually to celebrate the faith and the triumphs that we get to encounter as we follow him, as we humbly follow him. And just because we have some areas that we get wrong doesn't mean we're disqualified from walking with God and disqualified from building faith for our communities. So I think that's an important caveat. But I want to remind us that healing rooms, healing centers, healing ministry it's from the Bible, right? So we actually see this in the life of Jesus. This is what we're trying to model. We see this displayed in the book of Acts and throughout the New Testament, where the apostles functioned in the power gifts of healing, and God healed. And unfortunately, over centuries, some of the belief that God still does that slipped in and out of the church historically, and particularly in the Protestant movement, slipped out. And it wasn't until the last century that there was movement toward remembering that God still heals. And certainly we see that in the Pentecostal movement at the turn of the century, that they came out of the Wesleyan holiness movements and then this Pentecostal movement of rediscovering the spiritual gifts, rediscovering the power gifts of healing, of prophecy. Um, and in that moment, there was a lot of learning. I'm just going to say that, right? Learning about how to steward healing well. And the healing rooms really trace their roots back to John G. Lake, who was a healing evangelist right at the turn of the century. uh, and who's been celebrated for the faith that he had, and many, many documented incredible miracles that occurred when he prayed for people. But one of the ways that he was so radical was his belief that the ordinary, common Christian could pray for healing, and that it wasn't just the elite celebrity who had this special gift to pray for people and God healed. He actually believed God wanted to heal, and it was God who healed and not the person, but the faith of the person praying or the person receiving was really critical to healing. Um, he's also a controversial figure because if you do any reading, you realize he was actually um, he had some ideas about healing being separate from medical care, and he was actually quite forceful in his indictments of doctors and of medicine as it stood at the time. He categorized doctors with the devil. At the time, and I was reviewing some of his writings. There's an article about divine healing that he wrote in 1914, and some of the things he says are shocking. He said things like, "I used to be a member of a church where it was considered just as offensive to take medicine or go to the doctor as it was to go to the devil for health. The Christian who would run to a doctor was on a level with the adulterer or the thief, and that is absolutely right. That is according to the word of God. It is just as offensive for the Christian to take medicine as for the drunkard to take whiskey." And as a doctor, I find that quite offensive. I don't know about you, Mike. Um, but I would also point out, and he goes on, um, that some of that thinking and some of that believing has actually persisted in the mindsets and the thinking of the Pentecostal charismatic movement, and we see it played out even today. And I've even, in the last few years, seen some of these celebrity healing ministers, some of whom actually I really respect or I have really received good things from in the past. Um, repeat some of these things. I've heard some of them repeat some of the John G. Lake quotes that are very anti-medicine, anti-doctor. And it has obviously been a real source of grating in my own heart because actually I don't think that's biblical. And I would say, no, that's actually wrong. God does heal in many ways. Um, I think it's important to put it in context. So, although John G. Lake was an incredible hero in faith and in starting a movement of healing centers where ordinary Christians would pray for ordinary people who were sick and see them healed, that's incredible. And that tradition has continued. He also was a product of his context. And I think understanding that gives us some humility, gives us some ability to realize our own vulnerability. So John G. Lake, he lived at the turn of the century. And in all fairness, the state of medicine at the time, I mean, would be in
Was
a
not
doctor's
brilliant.
bag, right? Like what was in the pharmacopoeia at the time would have been morphine, laudanum, cocaine. Cocaine was used as a local anesthetic as well as a cardiac stimulant. Strychnine,
Mercury.
mercury, some what we would consider very dangerous and potentially harmful. Penicillin was not even introduced until 1928. And so he was living in a context of, although surgery had advanced significantly, germ theory had advanced, and they understood wound care a bit more. Still, the limits of medicine were far more restricted than today. And in fact, many of the at least the pharmaceutical types of treatments that doctors used were potentially very harmful. I mean, can you imagine being treated with large doses of opium and morphine and heroin and cocaine? And then as a minister, you might have a perspective on doctors that would be very different than the perspective we have now. So I think there's that context to remember. And then there's also the context of John G. Lake's personal life himself. And so just to review, he was actually one of 16 children. And he, in his writings, recalls multiple times his very troubled and sad childhood because 8 of his siblings died before they reached adulthood. And so he recalls living in a childhood filled with hearses and coffins and doctors and medicines and in like always there was death and dying and sickness in his household, and his parents were always struggling to move beyond the last grief and try to continue to care for and nurture their living children while still struggling with horrific grief. And his perspective was that doctors were completely useless. Like all of these important people in his life died. His first wife died of what we think is tuberculosis and a heart condition of some sort. And again, the doctors failed his wife. They were not able to save his wife, his first wife. So I think there's this context of pain and trauma from which he taught that medicine was incompatible with faith, and that God healed, and that was superior to medicine. And you can understand the context, especially because as he moved into his healing ministry, the nidus for the break point for him was several of his siblings who were dying actually miraculously healed at a Pentecostal revival meeting. And so he had an experience of God and healing that was radically different from all the pain and suffering that he'd encountered with the healthcare system of the day. And I think that context matters to understand. We sometimes make theology about God that's off in our context, in our pain, in our trauma. We have vulnerabilities to using our experience to explain God in ways that actually are harmful to us and harmful to others.
And I think that still happens today. I mean, I think that a lot of people bring their own personal experience, either good or bad, to this debate, in terms of if they've seen that people have struggled. People still suffer through medicine, in terms of things go wrong or they weren't helped, and that can lead to bitterness, or they just feel that they come under a teaching because they've seen someone be saved miraculously, and it feels more miraculous. I think people still think it's more godly to get your problems solved if God's done it directly, and I think that floods the sort of viewpoint of I'm going to aim for that one because that's the better one. That's a higher value one. It's back to this. It's not about whether they actually get better. It's more about did they choose the better route?
Mm. Well, even if you listen to some of the things people say or how they behave, you do understand what they believe, that it's not faith to seek medical care. If you're not healed through prayer, you continue to persist in it. It actually demonstrates your faith. It builds your faith to continue to reject healing through modern medicine. And I see that in John G. Lake's writings as well. And I think it bears saying we do not agree with that. And we believe that is wrong, it's false, and it's harmful. God is a big God, and He has created so many diverse ways to encounter us and to give us life, to restore us. And we believe that the continuum of healthcare, although also not perfect, God is breathing into, and God is leading us to discover many of His designs for healing that He already preordained for us to find. So I think it bears saying we don't believe that's true. So how can we position ourselves to celebrate faith and to celebrate the movement starters and honor what they've given us, while also saying there's some weeds here. We actually need to pull these out. These are false. These can actually harm people. This isn't what we believe, and it's not theologically, biblically sound. I was actually pondering this and realizing that God has actually given us a beautiful model for this in the pattern of Scripture. So you see in Hebrews 11 this chapter of heroes of the faith that are celebrated. And I think like many of us, I love that chapter. Just it's almost like a very condensed version of each of their lives and the high points, only the high points of their faith and how they are celebrated in the realm here after this, how they are part of the cloud of witnesses that celebrates us continuing. But I've also read their stories in the Old Testament, and I feel like some details got left out. Like, literally, some of these guys were characters, and they had some deep flaws, and they did some really actually wrong things. And yet, God celebrates, the writer of Hebrews celebrates their faith and their high points. And I think doesn't hide the real story, doesn't hide the things that entangled them. And we see in the stories of the Old Testament, I think these are such a gift to us to see ourselves in, to see how you can be entangled and to be able to identify it so that it doesn't have to continue on and be a tripping source for many, for generations and generations. We can have a model. We can see where you can get tripped up. You can see how you can get off. And you can celebrate the faith and the good things that you get to participate in. So I think that's how I view the beginning of the Pentecostal movement, the beginning of the healing ministry. But it is important that we also identify, hey, that piece, that was an entanglement for them. This is a compassionate view of why and understanding what that was, but also to say, no, that's actually not right. And we don't want to carry that forward. We want that to be weeded out of this garden because we are becoming increasingly aware that God is stirring up his desire for holiness and for righteousness to come out of this movement.
I think it's also worth saying that there have been people who've embodied some of that kind of teaching. So when Wimber came onto the scene, certainly in the UK, there was quite a cessationist movement within the church at the time. There wasn't a lot of healing going on. A lot of people thought that the signs and wonders were just from the Bible. And Wimber broke into that environment with his "everyone gets to play," and that was, that was what revolutionized how people viewed prayer. It was no longer the people at the front. It was no longer the powerful clergy. He just reminded everyone of that same concept that basically everyone gets to do it. And he used to run. I was involved in Vineyard during the Toronto Blessing, and he used to do doing the stuff conferences, um, and that was where he just taught people how to pray in a really obvious and and a very godly way. Um, and I remember at the time the challenge I tried to set up a doing the stuff in medicine group, because again it was very church based. But I think it's very right that, and people have stood up and tried to stand up for the principle that we all get to do it. God is still active, um, and Bill Johnson very much has tried to carry on that. As my understanding is that he got an anointing from John Wimber, and so there are streams that have tried to carry on this whole idea that we all get to do it. But unfortunately, at the same time, we have brought some of that baggage of the two-tier healing with it. And I thought Paul Manwaring covered this really well in the podcast he did with you when he talked about the fact that he doesn't see anyone sitting around waiting for God to supernaturally provide milk. That they don't have a problem with going to the shop and buying some, and that is still provision. And yet somehow we do. Some people do sit around waiting for God to heal them.
Hey, Healthcare Tribe, I hope that you have been impacted by what I've brought through this podcast. I also want you to know about opportunities to give back through my nonprofit, Selah Health International. We work to support projects for women and children of vulnerable populations around the world. You can learn more and donate on our website, selahhealthinternational.org.
And they define how God's got to do it.
Yes. Yeah. And ultimately, my experience is I have tragically sat with people who have declined medical treatment because they
Yeah.
felt it
Yeah.
was so imperative that they receive supernatural healing and that they stand in faith waiting for it, that they stood in faith waiting for it and died.
Yeah.
And
Yeah.
my perspective is tragically that was unnecessary harm and unnecessary death. And we would like to speak some life into that and to speak some balance into that. I
I just wonder if it's worth mentioning. I mean, Joyce Meyer publicly talked about when she was diagnosed with breast cancer, and she went to an oncologist who was a Christian oncologist, and he said to her, "Look, if you want to pray the prayer of faith and not take part in what we would consider best medicine, you have to know in your knower that God is going to do it." Because he said, "I have seen Christians die waiting for God to heal them." And Joyce Meyer was very honest about it, and she said she prayed almost all night, and then she realized she didn't have it in her knower, and she went through standard cancer treatment, and she's still going strong, bless her. Um, and we had a situation at our healing center where one of our volunteers who was praying developed breast cancer, and she decided not to have medical treatment. And Pete and I took the decision that we were going to step her down from praying in the healing center. And we explained to her that basically we could not have a volunteer who was basically saying, "I'm going against medical advice," because we didn't want someone coming to the healing center saying, "Well, what are you doing?" And she said, "Well, I'm not doing that." And we felt we didn't want to promulgate that viewpoint. So unfortunately, we asked her to step down, which didn't go down well with some of the church. They felt that was hard, but we felt we were so passionate to preserve the credibility of what we were doing that we felt we had to. And unfortunately, she died. Um, so it is important that we push against this idea that going for medical treatment is second class and bad.
Yeah. And we have participated in the other end of that spectrum as well, where divine healing happens in medical professional
Absolutely.
spaces as well
Yes.
as Christian and religious spaces. And so, um,
And it's wonderful when it happens. It's lovely. And it's so amazing when someone's I can vividly remember my first ever healing, which was a little old lady who had been plagued by an infected ingrowing toenail. And she'd had surgery, she'd had multiple antibiotics, it wasn't getting any better. And almost in despair, I said, "Well, how would you feel if I prayed for you?" And so I prayed for her. And I thought I'd review her in 3 weeks. And 3 weeks came in, she said, "Are you a healer?" I said, "What do you mean?" She said, "My toe is completely better." And she was overjoyed. And I was able to say, "Well, I'm not, but my God is." Um, and and I remember going to God and saying, "You only ever get one healing. That's your first healing. And this is it. My first healing is an infected ingrowing toenail. That's really gonna sell, in the years gone by." And God just said to me, "Well, could you heal it?" "No." "Did it need me?" "Yes." So I said, "Well, in that infected and growing toenail is every other healing you're ever gonna pray for, because you can't do those either." So it is something that I have seen definitely, and bigger ones, much bigger ones over time. But yeah, and it's lovely to see it in the medical context. It's both and.
yes, I think that that kind of segues into nicely this foundational piece that you and I both see as so critical to the healing ministry of Christ, which is the necessary component that we need to have of humility,
Yes.
because we aren't the healers, even as medical professionals who can do many things now, and have many amazing therapies to offer. I think a few people know that we have some restrictions too. We still have many things that we don't fully understand, that we don't have adequate resources for, etc. Um, and in that context, the same is true for healing ministers who function in healing gifts, that in fact it's God who heals. And we have
Mm.
a vulnerability to ego and self promotion whenever powerful and glamorous things happen, even in ingrown toenails being healed. But I think it's something that maybe we could we could start with, because this is something that we would love to see a realignment in. There is unfortunately a cultural trend within healing ministry of hyperbole and of self-promotion and of exaggeration. And I would like to say that we need to acknowledge that not a single one of us are immune to this vulnerability, um, that we would find significance and importance and value in the healing work that we do, and we would step out of this reliance on the Holy Spirit.
Yeah. I mean, an example is when I've heard from the stage at my church a comment that, we've had hundreds of healings, or we see hundreds of healings. Um, and when I was involved in the healing center, I knew most of them, and it wasn't hundreds. Um, and the reality is that, in conferences, when you get, they ask people to put their hands up, who's been healed, and you see, I don't know, half the audience puts their hands up. You've got no idea what's just happened. Got no concept of whether that's a genuine healing or whether that's an adrenaline surge that's caused pain to reduce. There's no capturing of the data, and it's just a false premise. It's based on exaggeration, and some of these then cause ridicule. Some of those of you who've been watching some of the videos going out of celebrated healings that have turned out to be not. Um, it's because people sometimes feel the need to talk up what's going on, because there's an expectation that you've got to create faith. You've got to create an expectation that healings are going to happen. And so there's almost a desire to feed the machine, to feed that anticipation. And because of that, you don't check what you're saying, because it's easier to say, there's loads of healings. It's happened. We had 12 last week, we had 30 last week, or we had hundreds. Now, hundreds sounds so much better than we checked them and we had 3, and maybe a fourth. We're waiting on an X-ray. You know,
And,
it, it
and those
that
three are individual people. I mean, I also think that these exaggerations and this hyperbole is also dehumanizing for the individual people who are experiencing illness or pain, and who are seeking healing, and some of them are healed. Um,
yes,
and to and to not care as deeply as we should about the accuracy of their experience and of their outcome, um, just for the sake of counting numbers, for the sake of this idea that we're building faith with that. I mean, I think we need to step back and remember, it's building faith is a co-laboring that we are invited into with God, but ultimately it's a gift from God. I mean, scripture is very clear that faith comes through hearing, but it's also very clear that faith is given as a gift from God.
absolutely, yeah. And we want people coming to either us as physicians or to our healing centers or healing rooms. We want their faith to be based on God, not falsely elevated by false claims, deceitful claims, exaggerated claims, or, I'm going to say it, charlatan tricks. And I'm afraid this whole leg lengthening thing is a charlatan trick. It's snake oil. And if you try and build faith on that, it's a false faith. And if you try and build people's hope on exaggeration or deception, it's a false hope. Whereas if we base it on what God is actually doing, it's based in reality. It's based on real acts of God. It's based on His infinite goodness and love, not on things that we've puffed up, blown up, or falsified to make it seem like there's so much going on.
Yeah. And does it diminish God's power or the expression of his healing that 3 people were radically healed versus 300 that we want to claim? Now, 300 people may have had a touch from God. And I think
Yes.
that the ability to be more humble and accurate, like actually taking the time and making the effort toward accuracy in what we report demonstrates an integrity and a commitment to the
Yes.
real power of God and to celebrating the real power of God. Because 300 people may have felt a touch from God. They may have felt the Holy Spirit's presence. They may have had a decrease in their pain in the presence of God. We as physicians know that there are some actual natural, physical, and psychological explanations for that experience. It doesn't diminish that experience. I mean, if you're in terrible pain and you have 30 minutes of decreased pain,
That's
that
that's a
is
blessing.
that is a blessing, and that is a something we can celebrate. Is it a full healing? Maybe not, but we're not diminishing God's presence, but I think we're not being accurate, especially when and if we were to follow long term with those particular individuals. How is their faith affected? How is their experience and relationship with God affected positively or potentially negatively by the fact we claim that they were healed and they weren't? And they're still dealing with their illness. They're still dealing with their pain.
Absolutely.
It matters. It matters that we are truthful. Righteousness matters. It is
Yep.
the foundation of God's throne. And if we are not truthful, then we are building a false faith. And I dare say the fruit of that will not be the authentic healing that we want to see, that we long to see, that God wants to see. And I think we need to clean it up. We need to clean it up.
Yep. And because otherwise harm can occur. I had a situation at my church where I think it's fair to share because it was done at a church, it was public. Um, one of the team was responding to a word given from the church member saying that God is doing a healing with lung illness, and she had a lung illness and she claimed it as her own, and God touched her. She actually sort of went down in the presence of the Spirit, and she was definitely being touched by God. The week later, she was invited to come up and give a testimony, and her testimony was that she decided on the back of that experience to stop taking her immunosuppressant treatment. Um, and she said that basically, normally, when she does that, she gets withdrawal side effects, but she's done it and she's not had the withdrawal side effects. Now, that's what she said, and the whole church erupted in clapping. Um, and I was thinking, what are you clapping? Because I'm hearing that you're clapping that she's not had any withdrawal side effects from stopping her life preserving medication. I'm not hearing that she's been healed. And in fact, I know the condition that she's got, and it needs radiological and immunological confirmation before she'd even know that she's been healed. And yet we clap that as a healing. And I just thought that this is just sending the wrong message. Plus, it's sending a message of the best thing to do when you feel touched by God is to stop taking your life preserving medication, which is so unwise. Um, so I had to find the lady and sit down with her and plead with her to tell the team what she'd done. She was due to have some objective testing in a couple of weeks, and said, "Well, look, if you've been healed, that will be better, and you can tell the team what you've done, and they can assess what to do next. If it's no different, then you've been touched by God, which we celebrate, but you haven't been healed."
And I think that we have a deficit of teaching about that. That's helpful. I think there's a lot of teaching about how to not lose your healing. We're going to get into that in our next go around together. But that there's some areas of that I feel could be potentially harmful and are off. And I think there's a need for wisdom. And I think this is where clinicians and health professionals can actually step in as fellow believers, as fellow workers in the kingdom, and offer support and offer wisdom and offer assistance, offer medical verification, offer assistance in tapering safely off of medications when you've been healed, etc. And you and I have had experiences with that as well. And and as this divide, this sacred secular divide is coming down, I believe that's God's heart. We actually see that God has already positioned the parts of the body to work together. Not one of us can say, "I don't need you." And so our healing ministers may also be health professionals, but our healing ministers and our health professionals should be able to cross the line together and join hands and bring a strength and bring a safety to people experiencing both illness and healing.
Absolutely. I do feel we've got to go to the leg length thing because we promised it.
Yes.
So um, I
And
think
you gave a fairly straightforward and, offensive statement about leg length charlatry. So
absolutely, yeah.
what do you think,
So
Mike? What is going on with this
it's
thing that we
snake
see
oil.
all over the
It's
place?
so I can give you. I have to say, and I don't. And there was lots fantastic things about the Bethel healing rooms I went to when I was last over with you. But I went with just an open mind. I was going to see how they did it and what they did. And in the lineup before you actually sort of go into the main center, they just that some people were saying, what's your problem? And I was going because I've actually managed to blow out 3 discs in my back over time. So I said I had a problem with my back that I wanted to pray for. So the first thing that a person did was got me to put my legs out. And of course, one was longer than the other because I'd happened to just sit slightly askewed. And my wife, bless her, started to say to this woman, "My husband's a doctor, and he doesn't, he's not going to appreciate you doing this." And actually, I said, "Just leave her be," because I'd gone with the idea of just going to see what they do. But while she was talking to this prayer minister, I'd actually shifted in my seat, and so my leg length had now changed so that the short one had now become the long one. And I was just curious to see, when she turned back to see my legs were now at a different length, how she was going to manage it. And it was just, she just then took it as a sort of assessment of what my back was doing. And it's a classic. Oh, you have one leg longer than the other. That's why you get back pain. Um,
So
and
there's a couple things in that, right? So first of all, a physical exam maneuver is being performed on you by an unlicensed and unqualified non-medical person.
absolutely,
Let's just say it what it is. F are we promoting that? Like, actually, our governments don't want people who are untrained, unlicensed to be performing medical exam maneuvers or treatments. So why is this something that we're doing in our church settings or in our ministry settings? That's one. And two, in great I think in great ignorance and in good intentions, some healing ministers are actually giving a diagnosis
mm,
based on a perception of an incorrect physical exam maneuver and telling people their pain, their symptoms are due to a diagnosis, which is actually, it is possible to have a leg length discrepancy, isn't it? Like, that's
it is
actually a
absolutely.
potential possibility.
But you normally get a very big clue, which is they've got a huge raise on one leg, on their shoe, on one leg. It's normally blindingly obvious that someone's got a medical problem in that way. And what they're getting hung up on is real versus apparent leg length, which is, basically it's a well-recognized phenomena, which is that there are all sorts of conditions that can make your legs seem shorter, which can be spasm in the psoas muscle, it can be scoliosis or spinal abnormalities, it can be hip abnormalities in the pelvis, or it can be bone length abnormalities in the leg itself. And so anyone who's ever been medically trained and wants to work out how long a leg is will know you have to measure real versus apparent leg length, which is basically you put a tape measure either at the umbilicus and go down to the medial malleolus of the leg, at the ankle joint, or you do it from the xiphisternum, from the chest wall, down to the medial malleolus, and then you find your anterior superior iliac spine. Now, I'm sure as a gynecologist, you're very well aware where the
I
anterior
am,
superior iliac
actually.
spine.
But the
But for
medial
those who may
malleolus, I
not,
don't do a whole lot with that on the ankle.
actually, no, it's a bit far away from your your professional area. But for those of you who aren't quite clear what we're talking about, it's the bony bit of your pelvic of your hip joint that you can, or your pelvis, you can feel at the bottom of your tummy. There's a bony prominence that is your anterior superior iliac spine. And basically, if you want to do it properly, you stick a tape measure on that bit and you run it down the leg towards the inside bony prominence on the ankle. That's the real leg length.
Never in a seated position. That's never the correct.
Never is no, lying down.
Fine. Occasionally standing if you're doing, like, the box lift test, which is another
Yeah,
one, right, that's done, but almost always supine, laying down flat. So this whole
yeah,
exam
absolutely.
maneuver, there is a correct way to do it, and it requires significant training and experience to do it correctly.
Yeah, and that will give you the real and apparent leg length, and that will tell you if there is actually a medical problem with the leg. But just lifting legs up when they're sitting in a chair, and I've seen it in so many places. I've seen it on street ministry. It's all over. And then what happens is you get prayed for, you relax, your posture changes, so the leg is then changes its attitude,
There's a stretch
and
that's
it's or there's
happening.
a little gentle a little gentle
They like
pulling.
there's a way to do it in a magic trick way where you jiggle a little bit, so you actually release. It's almost a bit of a chiropractic maneuver,
Yeah.
to release some of that muscle tension in the low back, and voila, when you
And
stand up, you
and
feel
then
better,
and
a
people
little better.
claim that, yeah, they and I have seen people claim that the leg has grown.
Yes. Well, and I've seen
Or
them
that
pray, like, fervently, "Leg grow, grow, grow," and there's this commanding, prayer that is taught, and I see it a lot, so I think this is part of the culture we've developed that the leg is going to grow, and sometimes there is the sense that it moved, which, as we would point out, can happen from this tonic stretch on the all the muscles of the pelvis, the pelvic floor, the low back. It's a SI joint dysfunction, perhaps, and there's a release that happens in that muscle, and there can be apparent movement of a leg. And you and I and every health clinician I have ever talked to, we all face plant when we see this because we know this is a magic trick. There's a medical explanation for it, and it's a false healing.
it is. It is fake, and everyone stands and applauds, and they think they think it's amazing, and they think it's God, and it's not. And what happens is that it just loses the credibility of the people doing it, and it loses the credibility of the places that do it, because ultimately it's not just about pleasing medics. It's not just well, we know this annoys the medics, but we're going to do it anyway. But actually, journalists know, the public know. There are people who can just see, well, that's just rubbish. And when you do rubbish in God's name, it brings everything you do in disrepute, because then they're not going to believe the true, genuine healing that happens, because they're going to go, well, I've seen what they're like, I've seen what they do, and
And
and it
could God
it
be
promotes
healing while
disbelief.
we're doing that? I don't think we're discounting the possibility that a loving God might actually heal that person that is receiving a scam healing prayer with well-intentioned by some people who are believing that they're performing, and that's probably another issue, performing, a healing. God could grow a leg. I actually believe that. I
Yes,
don't think
yes,
that's outside of the realm of possibility, so that's radical for a doctor to say that and believe that. But I actually, I believe that the majority of what we're seeing in this practice is fakery and harmful, potentially harmful.
absolutely. And it's all part of this thing of hyperbole and exaggeration. Why do it? God is a God of truth. And actually, when you perform a lie, because it is a lie, and you do it in God's name, that's sin. So we're encouraging people, we aren't, but but the training is encouraging people to do something where they are doing an act which they proclaim to be God when it's not. That is a pathway that we don't want to walk down. And I think some would call it sin, some would call it potentially heresy when you claim it's a God thing that it isn't. Um, you know, we don't take it seriously. And I know that there have been medics who've talked about this and pointed it out in Christian centers for a long time. And I think it's ignored because it's good press. It looks cool. and it brings the punters in.
I mean, there's a part of me that's like has such a mercy heart for the people who participate in this, many of whom I know are not doing it out of a heart to scam people or to deceive, but they just genuinely believe this is a real thing. Um, but there comes a point where you have to say, I understand this is your ignorance. I understand this is innocent, but it doesn't make it less sin. And now it needs to stop. Go and sin no more. Let us have real healing. Let us clean out, let us weed out these things. Let us help each other in our areas of ignorance and in our areas of vulnerability. Um, it, it is a good moment for all of us to look at our hearts and say, am I vulnerable to either receiving or doing these things because there is some insecurity in me that is being fed by the glamour of this thing that I'm doing? Am I holding on to it so tightly and refusing to let it go, defending it as a thing of healing, even when the doctors and the physical therapists and the anatomists are telling me this is a scam, this is not correct, this is false? Am I holding on to it so rigidly because I need it to prop my own insecurity up? Do I need it for my ego? Is it about the people who are hurting that need healing? Is it about the compassion of God, or is it about me being right in this thing? Is it hard for me? Is it hard for me to repent and correct?
Yeah, that's good.
Yeah. We have a lot of other, I think, interesting topics to discuss, and I know for many healthcare professionals, they're going to be relieved to hear us bring this up. I think we're probably not going to be 100% right on everything we say, Dr. Mike. I think we're willing to.
Well, there's a saying in medicine, isn't there? There's no such thing as never and always. So we are never going to be 100% right.
And I think even the fact that we're willing and brave enough to bring up some of these issues and start the dialogue and to welcome in more expertise and welcome in the wisdom of the Holy Spirit and the God-given design of our brains to reason and to think. We don't think we should have to check our brains at the door. I think it's important for us to engage. And so we want to invite our health professionals, our ministry partners to engage in this dialogue, engage in this discussion, come with open and humble hearts, be ready to receive correction, be ready to confront each other in love with the goal of restoration and greater purity, greater righteousness, greater holiness, that we would represent the pure message of the gospel of Jesus Christ. We would represent it well in healthcare, and we would represent it in all of the ministry iterations, all the ways that God meets people and touches them.
Absolutely.
I'm looking forward to spending a little more time with you coming up soon and talking about more of these issues. But thank you, Dr. Mike, for your insights, for your much needed humor, and for being willing to do straight talk with me. And thank you to all of you for being with us here today. This is the Restore Healthcare Project, and I'm Dr. Jennifer Kay. Healthcare professionals, I'm so excited to be able to connect with you on issues regarding spiritual needs in healthcare. We want to partner together to see some of the ruined places of healthcare culture restored by hope. Follow us at restorehealthcareproject.org and like and subscribe to our YouTube channel and social media.